Hello friends. 5 most important things about acne that you must know. Yes, my friends. 5 most important questions about acne that pops up in your mind every time you see a pimple on your cheeks. I will tell everything about that, and at the end there will be a bonus. I will bust some myths that every pseudo expert nags about pimple all the time. So let's not waste any more of your precious time and dive right away into the topic. Number 1, when and where acne occurs. Firstly, it can appear after first few days of life, which is called infantile acne. It disappears within few weeks. In some cases, it may last for few months to up to maximum 1 year. But if it stays beyond first year of life, then you must visit a dermatologist. Again, it reappears uh, during your puberty, which is around 11 to 12 years of age, and usually clears up within uh, 25 to 30 years of age in most of the people. But it can appear in your 30s, 40s, or even 50s. The chance is very less that someone can not get acne at all in age between 10 to 30. But if someone evades teenage acne, then there is a high chance that he or she may get acne at a later stage of his or her life. We all know face is the most common site that is affected in acne, but the upper back, chest, and upper arm can also get affected. The next important question is, what are the things in your life that can influence acne? And there are a lot of things that can influence acne. But here I will just discuss few of them. Firstly, your genes. Genes play a major role in acne formation, but it is something that you cannot change. So let us leave it aside for right now. Next is your diet. Foods that increase blood glucose level very quickly after consumption are called high glycemic index foods. These kind of foods can increase acne. Now, smoking. It is seen that in mature women who are chronic smoker, they have increased chance of getting acne. Now, stress. In case of severe stressful conditions, acne increases or its severity increases. Especially in case of students, in some studies it has been seen that their acne severity increases just before their exam, which is obviously a stressful condition. And next thing is use of cosmetics. Cosmetics that are very greasy or oily or contain substances that are comedogenic can also precipitate formation of acne. Now see, we all go through this stage. We all develop acne in some point in our life. Here comes the third most important question, and that is when we should seek advice from our dermatologist. Firstly, when neonatal acne doesn't go away after first year of life, we obviously should visit a dermatologist for instructions about what to do next. Secondly, if you develop large number of acne suddenly, which appears after consumption of a new drug that has been prescribed to you, or after use of some cosmetics or some makeups, etc., then you should definitely visit a doctor for consultation. Thirdly, if you have very severe forms of acne, which is large in number or large in size or very painful or may have discharging pus or involving a large surface area of your face together, or if there is any other symptom associated with your acne which suggest polycystic ovarian disease or any other hormonal problems, then you should always consult a doctor, because the other associated problems may be of due to some other disease which can cause a lot of problem uh, to you. It's a very big topic of discussion, that I will do some other day definitely. But here I will just say, if you have any other symptoms with your acne, then you must visit a doctor for proper diagnosis and treatment. And finally, if you have any form of acne or acne of any severity which causes severe psychological stress or which affects your day to day life, then you have no other option but to see a doctor. Now, the fourth most important question is, what are the things that you should do to avoid getting acne? Regular exercise, my friends, regular exercise, that is not only beneficial for your skin but your overall health as well. Maintain a healthy diet, which is very important. Wash your face after getting up from bed and at the evening after coming from outside with a skin friendly soap or face wash that is prescribed by your dermatologist. Avoid getting dandruff because it can aggravate acne, and moisturize your skin regularly with a moisturizer that is prescribed by a qualified dermatologist to you. Now, question number 5. What are the things that you should not do? Firstly, you should not apply comedogenic substances or comedogenic cosmetics on your skin, and you should not also apply pressed powder on your face. Secondly, you should never scratch or pick your acne lesion because it can lead to more severe infection, permanent hyperpigmentation, and permanent scarring. Avoid vigorous and excessive washing of your face. Never apply any cream that has been suggested by your friends or relatives or neighbors or any local medical shop. Now, to avoid mask induced acne, you should never wear a disposable mask if you have removed it once. Never wear a surgical mask for more than 4 hours at a stretch. If you intend to wear a mask for longer period of time, never apply any makeup before wearing your mask. And you should always wash your cloth masks before you wear them. And last but not the least, never visit a quack or a fake doctor for the treatment of your acne. Now it's time for the bonus. But before I finish my video, if you like to see more informative content like this in the future, then just subscribe the channel and hit the bell icon. And if you like this video so far, then you should share it and like it. Now it's time to bust some myths. Myth number 1. Indigestion and constipation may cause or increase acne. You see, it is absolutely false because in otherwise normal people, indigestion and constipation may occur sometimes. That doesn't increase your acne at all. But yes, if you have a disease which is called irritable bowel syndrome, then there is a connection. It is seen that patients with acne have more chance of developing this disease than patients who don't have acne. Myth number 2. Sexual activity increases acne. Absolutely false. Though sexual activity increases the hormonal level in our body, but even after extensive search in the internet, I could not find any study that shows that any kind of sexual activity can increase or precipitate or aggravate your acne. Myth number 3. Regular facial can reduce acne. Absolutely wrong, because the act of facial itself causes rubbing and friction over your face, which can itself aggravate or precipitate acne formation. Myth number 4. Washing your face frequently can reduce acne. Wrong. Rather, Washing your face vigorously and very frequently can precipitate or aggravate acne. Lastly, myth number 5. Acne is natural, it is not a disease, and it requires no treatment. Absolutely wrong. Though most of the people suffer from less severe forms of acne, but there are so many patients whose quality of life and health get jeopardized by acne, and those patients needs immediate attention and adequate treatment by a qualified dermatologist. So that's it for now. I will meet with you all in my next video. Till then, take care, be healthy, and thank you.